Hello and welcome everyone to this video where we will try to understand the importance of clinical medicine in current practice. First of all, let us understand the approach to a patient in a ward or in an OPD setting. Whenever a patient comes to you, he comes with certain symptoms or certain complaints. Your challenge as a doctor is to reach from the symptoms to the diagnosis and plan the treatment and investigations for your patient. Now, in order to reach from the symptoms to the diagnosis, you need to assess your patient. Now, let us understand how do we assess a patient. To assess a patient, we nowadays follow a clinical investigation approach. Decades back, when investigations were not so much available, during that times the doctors used to use a clinical approach. You must have heard from your parents or your grandparents, they used to say that during their times the doctors used to talk with the patient and examine the patient, and that was enough for them to give a diagnosis and decide the treatment plan. But in this 21st century, where we have a wide array of investigations that are available to us, the approach has changed from a clinical approach to a clinical investigational approach. It includes both clinical assessment as well as investigations. Nevertheless, clinical assessment has always remained a very important component of patient assessment. It also helps you to guide the investigation plan of the patient. So now, what is the importance of clinical assessment in patient care? Clinical assessment of a patient includes two components. One is the history taking part, where you listen to what the patient has to say about his symptoms, about his discomfort, and also the examination, where at the bedside you as a clinician try to elicit certain signs on the patient. If a proper clinical assessment technique is followed, then you can rule out a wide range of diagnoses and narrow down your thoughts to a specific set of diseases, or sometimes only to a specific organ system. The range of diagnosis that you get can be divided into two main sets. One is called as the provisional or working diagnosis, and the others are differential diagnoses. The provisional or working diagnosis is that diagnosis which is most likely based on the signs and the symptoms in the patient as well as the current scenario. And the differential diagnosis are other set of diagnoses which are less likely but cannot be ruled out based on the information that you have at this point. Now, based on this information, you have to decide a treatment plan and the investigations for your patient. So, is clinical assessment everything? Not at all. Let us try to understand now what is the role of investigations in patient management and patient care. Investigations help you to confirm the diagnosis, which is the provision or the working diagnosis. It also helps you to rule out other differential diagnoses and to assess the severity of the disease. Therefore, when combined with the clinical findings, the test results can guide the treatment plan as well as modify the provisional or the working diagnosis in certain scenarios. Now, a very important thing to understand: what is the role of clinical assessment and what is the role of investigations, their merits and demerits. Clinical assessment is a very subjective technique. It needs good communication skills and proper examination methods. Clinical assessment is something that a doctor does at the bedside. He needs to talk to the patient and understand what the patient wants to say. In this case, you must have very good communication skills. The patient will speak in his own mother tongue and in phrases which he has colloquially or locally heard being said. But as doctors, we read the textbooks. The patient may not always speak the language of the textbook, but your job as a physician is to understand what the patient means to say and how does it correlate with your textbook knowledge. And that is why this technique sometimes becomes very, very challenging. However, it is the first step in patient management, and therefore it is imperative to master a good clinical assessment skills, which requires a lot of practice. The second part to it is investigations. Now, the advantage that investigations offer over clinical assessment is that it is an objective technique. You do not need to have any sort of clinical encounter with the patient. Even if you are unable to converse with the patient because of language barrier or because of your poor communication skills, investigation results will not be affected at all. However, each and every investigation has its own limitations. Some investigations may be purely anatomical, which can tell you the structure or the anatomical part, the organ that is affected in your body. Some can be purely functional, which can tell you the severity of the disease involvement, but both of these may not shed any light on the pathological process at all. So for interpretation of the investigations, you require the clinical information of the concerned patient. Therefore, even in today's scenario, clinical assessment plays a very, very important role in planning the patient management as well as the patient treatment. With experience and practice, you can have a proper blend of these two tools, clinical assessment and investigations. And when blended properly in a particular scenario, they can offer wonderful patient outcomes. Thank you. That's all for today. In the next series, we'll try to understand further the art of clinical medicine. Thank you.